Beschnidt.
Good morning.
Can you tell us some words about the wand system?
Yes, of course. I'm using the wand system since 1998. I was one of the first German users, and we started to use it in anxious children by using a system which doesn't look like a syringe. But during the last 20 years, I could see that this system has much more importance that it was built for. And one of those advantages is that the system helps to heal soft tissue, not by healing itself, but by not giving trauma to tissue. If you give anesthesia with a wand, especially in compromised patients, patients with cardiac problems, or even patients with diabetes, you have a much better wound healing, and of course, in the end of the day, a more sufficient situation according soft tissue stability. And more of our patients get higher demands. They want to have a reliable healing, no pain, much more comfort during treatment. And in my opinion, a new computer-controlled anesthesia delivery system like the wand, which is the mother of the systems, is how to be really gentle to your patient and to your tissue. If you give anesthesia to a patient, you put in a liquid into a tissue which has normally no space for liquids. So if you give it with a syringe, you just compress the tissue, which means on its own it's a trauma to the tissue. If you give it with this anesthesia system, you give it with such less pressure and more stability to numbness and more stability to tissue, and so you give anesthesia with more help for healing and more blood supply for surgery. Of course, you can't completely remove pain, but especially in areas where you normally have a lot of pain with a syringe, especially in the palatal area or in the posterior area or anterior front, you don't feel this anesthesia during giving the wand anesthesia. It is a benefit for very young to very old.